Hey everyone, it's Dr. Sarah with Discover Wellness Chiropractic Center. I'm here to talk to you a little bit about what Webster's is. So if you follow us, you'll certainly learn that I love doing pregnancy care. It's my favorite thing to do. I will see anybody under the sun, but pregnancy is my number one. So when you're looking for a chiropractor for your pregnancy, you want to make sure that they're Webster's certified, and there's a website that I will put together in the show notes so that you can find a Webster certified practitioner. But if you're in our area, follow us and come see us in the office, especially if you're pregnant. So what is Webster's? So Webster's was created specifically for pregnancy, but it can be used for anyone who's weight bearing, meaning that anyone who can stand. So what Webster's is a specific adjustment for the pelvis that helps with the pelvic outlet. So what it works on is the joint, muscles associated with the joint, and then ligaments that are also associated with the pelvis. So what we want to do is focus on the back part of the pelvis, the front part of the pelvis, so that this pelvic outlet stays nice and open for baby to start to come through. Whenever we're performing a Webster's adjustment, we're working on these joints right here. So a lot of times pregnant women will be experiencing sciatica or sciatic pain because where the nerves exit and go down into the legs, it has to come through this muscle region. So with Webster's, we want to focus on keeping this movement in the sacrum flowing. Whenever someone is pregnant, because the baby hangs out on the right side of the pelvis a lot more than the left throughout the duration of pregnancy, it can often cause restriction on the right side of the joint. Whenever people come in and they're experiencing sciatica on the right side, it's not surprising. And what that means is that there's rotation going on in this bone right here, jamming up this joint. Now, because whenever the pelvis misaligns, it does opposite of one another, what we often find that is if this is rotated and jamming this joint, we're also going to have issues on the front part of the pelvis equal and opposite to that. So what we want to do is keep symmetry here because the pubic symphysis is also going to have to move and open up during the delivery of the baby. So what we work on is the back part of the pelvis, keeping the sacrum nice and level so that it can swing away during delivery. We work on the glutes and the piriformis on the outside of the hip. And then we also work on a ligament called the sacrotuberous ligament because that's the foundational ligament of the pelvis. So by releasing the ligament, stabilizing the joint, and stretching these associated tissues, it's gonna bring a lot more stability to the sacrum, allowing the muscles and the tissues to start to relax down. Now again, because the pelvis subluxates or misaligns opposite of one another, we want to then turn the patient over and start working on the pubic bone on the front. So what we want to do is make an adjustment to the pubic symphysis, work on a round ligament here, and then also stretch out something called the psoas muscle. So the psoas muscle, whenever it's developing, it attaches up here to the lumbar spine, cuts through the abdomen, and attaches down onto the hip. So you can imagine that if we have instability back here, it's gonna really shorten up that tissue or that muscle within the abdomen itself, pulling tension here. We wanna stretch that out, again, to make sure that this outlet stays nice and symmetrical. Because if it's pulling tense, you can see that that is not as symmetrical as we want it to be. Not only can that cause distress during pregnancy, but it can also cause the baby to not have as much room as possible to get down into a proper position for delivery. So the whole purpose of pregnancy and chiropractic is give you more space for you and your baby. But it'll also help with not only your comfort level, it'll help with your stress levels, it'll help with your muscle engagement, and as well as chemical balances between mom and baby. And we're gonna go over that in this next 4-week series on why Webster's and pregnancy is important. Stay tuned for more content.